Chikomborero Chakawa. I am part of the Women Ascension Community Outreach Training Program. And today we are hosting our first ever webinar on drug and substance abuse, which we've actually dubbed under the theme substance abuse and, in community engagement series, sorry. Before I introduce my speaker, I would want to introduce Mem Mayin, who is the founder and director of Women Ascension, so that she can just briefly tell us about Women Ascension and what it's all about and everything. Then we go on to our next speaker. So over to you, ma'am.
Thank you, Chikomborero, for giving me the floor. I will not take much time. We started Women Ascension almost 4 years before. It's going to be 4 years in 2025. And within these time periods, we were able to reach a lot of individuals around the world. And if we talk about specific countries we have reached so far, it's 81 countries and counting. So what the beauty of Women Ascension is that we are connecting people. We are trying to build their profile and make them know exactly what's happening around the world in different prospects, covering all area of SDGs and also improving each other's, not just professional capacity, but also personal development as well. So because if you want to grow, you want to have quality of life, if you want to sustain yourself, it can only occur if you balance yourself professionally and personally. And as long as you have economical sustainability, that you can only get through capacity building and understanding of the world around you, can make you a better person with time, not just for you, for your generations ahead. So this is the whole ideology behind Women Ascension, and I hope one of the topics that we have chosen today with our fellow, Mr. Chikomborero, and this is an excellent topic. We all are having and suffering with this phenomena around the globe, not just country to country. Globally, we are affecting through it. So we have different countries around, participant around us right now. I hope to see more inclusivity in giving feedback as well. So we are very excited to have you all on board. Thank you, Chikomborero. Thank you, Ms. Lindani, for joining in. Over to you.
Thank you so much, ma'am. So today we are touching on the topic under the theme Building Resilient Communities, Strategies for Substance Abuse Prevention. So we are basically focusing on fostering strong, supportive communities to reduce the risk of substance abuse. The key aspects in this entire topic is 1, understanding community risks and protective factors. 2, developing prevention programs for youth and adults. 3, collaborating with community organizations and stakeholders. 4, addressing environmental risk factors. So overall, the goal is to strengthen community resilience by leveraging partnerships and resources to create environments that prevent substance abuse. My speaker for the whole topic is Lindani Mushanduri. She is a registered social worker, a drug and substance abuse specialist, a researcher, and a human rights advocate and author. So I would like to actually give the floor to her so that she can explain more about herself, and then she can just dive deep into the topic for today. Over to you, ma'am.
Good evening, everyone. I hope everyone can actually hear me. Can you all confirm that you can hear me?
Yes, we can.
So that I can continue. Okay. So like Chico said, my name is Lindani Mushanduri. I'm from Zimbabwe. I'm a social worker by profession, and I'm also a researcher and an author, and mainly I focus on drug and substance abuse. So today I'm going to be speaking about the issue of building resilient communities and strategies for substance abuse prevention. So I think before we start, we need to first understand what substance abuse is. We need to try and understand and have a bit of an appreciation of when we say substance abuse, what do we mean? So when you say substance abuse, we are talking about harmful use of psychoactive substances, which include alcohol or illicit drugs, which can lead to adversaries on an individual's on an individual who uses them, and also it affects the society at large. So I'm going to be focusing on the international community. I'm not going to be focusing on my community only, but on the international scale. I try to explain what are the risk factors of substance abuse, what are the protective factors of substance abuse, and so on. So firstly, I think when we are talking about substance abuse, there are different, we need to address the risk and protective factors. This requires a comprehensive approach that involves the family, the community, the school at large when we are looking at substance abuse. So firstly, I'm going to be talking about risk factors for substance abuse. So the first one that I'm going to be talking about is the academic challenges. So when we say academic challenges relating to the substance abuse, what are we saying? I'm saying that sometimes when a person is at school, going at school, we see that to concentrate with schoolwork, sometimes it's a challenge. You may be trying maybe to read and focus, but then you find it hard to do that. So you see that people may end up doing substances so that they're able to concentrate for a very long time, and also to be awake so that they're able to focus and read. For example, we see that there are different substances that are actually used by people when they want to stay focused in their schoolwork. Someone may use marijuana. According to people, through the research that I once did, I discovered that people actually do use marijuana or weed in order to stay awake for very long hours, so that they are focused and they're able to concentrate and read, and they're able to improve academically. So hence you see these are some of the risk factors. Also, there's always also the issue of family dynamic. By family dynamic, what are we saying? We're saying that someone may grow up in a family where people where both parents use drugs or use substances. Hence, through social learning, a child might learn those behaviors from seeing their parents doing that, or their caregiver or their guidance doing that. Hence, you see that they end up doing this substance abuse, like taking substances, because it's a certain behavior that they have learned since they were child. They grew up in the fact that they grew up in an environment that does certain things, they'll learn that that behavior. Also, we can actually talk about the availability of substances. So by this, what do I mean? I mean that you see that substances are readily available for people to use. They're at a person's disposal, or because there are no regulations, but they're available for people to use.
Officiel, donc on reste voilà, désolé. Vraiment, depuis que j'ai 2 téléphones, je sais pas, c'est compliqué.
Okay, as I was saying, another risk factor when it comes to substance abuse is social norms. By social norms, what I'm saying, there are certain communities, especially, I will give an example. I'll give an example here in Zimbabwe. We have a society in Binga. They normalize drug use. It's their culture to do substances. It's their culture, they do that. So I want to believe in so many societies, so many countries, there are other cultures like that. So in cultures like that, you see that people end up engaging in these behaviors because they are normal to them. It's their norm, their social norms. And you see that people end up using those drugs. Also, another risk factor that we can actually look at is poverty, because economic hardship. When I talk about poverty, I'm talking about the issue of economic hardship. This can lead to stress and limited access to resources, which may contribute to substance abuse disorders. We see that communities with high level of poverty experience increased rate of substance abuse because people will be trying to they indulge in substance abuse so as to cope with their current situation, so as to be able to to lighten their burden, so they say. So and I think if we all have any questions, we can actually discuss them after the training. Also, I would like to look at the protective factors of substance abuse. So when we say risk factors, we are talking about issues that causes people to use substance abuse. So now we're looking at protective factors. We mean things that we can do to reduce or to mitigate the use of substance abuse. So the first thing that I'm going to talk about is community engagement. By community engagement, what do I mean? I mean that we need to be able to engage the community in activities or programs that reduce the use of substance abuse. We need to engage the community to provide youth with a constructive alternative to substance abuse. We need to have community projects so that the youth or people are able to be empowered and reduce. When they're empowered, they don't have now the time to focus with substance abuse. When they're empowered, they're able to focus on the projects that they'll be doing and able to improve their livelihood. We need to do community engagement, and we also need to talk about strong family support systems. What do I mean? We need to, if a family if a family provides their children or provide within each other, they provide each other with emotional support, whereby there's open communication, right? We see that this reduces the chances of people in indulging or people taking substances, because if a family has a good and safe environment where people are able to express their feelings, where people are able to talk about their day-to-day life and express their pains and worries, it reduces it. They're able to lighten their burden by talking, expressing their fears, expressing just that environment that enables people to open up, that environment that enables people to lighten their burdens, those burdens that they'll be those burdens which may make them to want to do drugs or substances. So there is need to have strong support systems in families. So how can we do that? How can we establish? I think the question now is, how can we establish a strong family support? We can do this by doing, there are programs like positive parenting programs that we can actually, introduce to the community, educating parents on how to take care of their children in a positive way, in a way that is open, in a way that provides them, that is able to create that environment at home where they're able to talk to their parents and without fear, but to make home a safe space. And also other protective factors that we can actually look at, it's doing my education, access to education and resources. What do I mean by that? I mean that I believe that in each and every country, there is need to make, when it to introduce the use drugs and substance abuse topics in the education curriculum, whereby in each education system, we are going to be talking about substance abuse from a very, very young age, like from elementary school or from grade 1 to tertiary or university, so that people and children grow up knowing that, substance abuse is dangerous and it's not good for our health, that substance abuse is not the way to solve our problems, but then there are other things that we can actually do to solve our day-to-day problems, and other things that we can actually do in order to have a positive livelihood. So I believe that there is need to include this substance abuse topics in the education system. And also I also believe that there's need to also to do media campaigns, awareness campaigns, whereby in the media, social media, we have different media platforms, where Instagram, Facebook, TikTok, and so on and so on. We can actually do campaigns on social media platforms, whereby we'll be educating people about drugs and substance abuse, and also offering telecom support, whereby we give people telecom support, whereby we're able to do the virtual counseling, virtual support to people, hence reducing the use of substance abuse among people. And I do understand the fact that when we want to address the risk and protective factors, this requires a comprehensive approach. That, like I said initially, a comprehensive approach where it involves everyone, from the family, the school, the community, because all those systems, they contribute. They contribute to substance abuse, and all the systems govern and contribute to who we are as we grow up. So we need to include all the systems to address the issue. So, and also going further, there's also need to look at the communities. We need to look at the community's needs and community assets when we want to deal with substance abuse. What do I mean by that? I mean, we need to look at the community assets. What is in the community that we can use, the existing assets that exist in the community that we can use in order to address substance abuse. And then we also need to look at what the community lacks, what the community needs in order to address substance abuse. Sorry. So by assets, we're going to be looking at within our community. It might be Pakistan, it might be, South Korea, it might be, wherever. We need to look, okay, we look at the community that is affected by substance abuse. We want to look at, okay, what resources or assets do they already have that we can use to reduce substance abuse? And then look at what are their needs, what lacks from the existing assets, which we can, add on to the existing assets, so that we can also address the use of substance abuse. So that community assets may actually how the assets may already include maybe the healthcare providers or or healthcare professionals. This may include nurses, doctors, So we're going to be working with these professionals in order to help people who are already using substances but want to, stop using drugs and want to start the journey of getting sober. We also want to look at if there are any support groups that exist. We need we want to look at if there are any existing support groups that exist or counseling services that exist in that particular community that we can actually use in order to help people who are using drug and want to start the journey of recovery, or people where okay. So we want to look at support groups that exist, support counselors, social workers, psychologists. We also want to look at, like I said, we're looking at the existing community assets that exist in the community. If we have any organizations, we engage different community organizations. You go to a certain organization and say, okay, you know what, this is the issue that is happening in our community. Can you please, can we work together? Can we work together so as to come up with programs that can actually help people, help youths, help women, help men, help elders, how it can help everyone who uses substances abuse so that they can start their journey of recovery. And then we also look at what the community needs. What does the community need? Okay, you have looked at the assets that exist in the community. Now you want to look at what does the community need in order to stop or reduce or mitigate substance abuse in it. So what are we going to look at? We're going to need youth programs. We need to collaborate with different stakeholders, from the government, from every stakeholder that is going, we're going to need every stakeholder. For example, when you start a program in a certain community, you need to go, I'll give an example from in Zimbabwe. Let's say if it's in the rural, you will need to go to the sub-book, you need to go to the chief. You need all the stakeholders, you need them, because these are people who already live in that community, who know the community, who people can actually trust before you can come into this community and start your program and say, you know what, this is what I want to do. So you need to collaborate with different stakeholders. And also you also need to, because when it comes to substance abuse, we also need to increase or have treatment centers that cater for everyone. Those treatment centers have to be available, accessible. Okay, I think they are called the 4 A's of health, if I'm not mistaken. It's availability, accessibility, affordability, and the fourth one, I've forgotten the fourth one, but when I remember, I will tell you. So you need to take into consideration all of those factors. Okay. Do we have any questions before we move on? Any questions from the floor? I want this to be sort of like an interaction. I don't want to be the one who's always talking. So if you feel like you want to add on, please feel free to, before we can move on, if you feel like you want to add on from the things that I've just said, please do. Please do. I want this to be as interactive as possible. I hope you're all understanding what I'm saying. Can I at least have a thumbs up? Okay.
Okay, thank you, Neradzo. Thank you very much for a wonderful presentation. Thank you. We are tipping into it. We'll be waiting for the last 4 A's that is needed for rehabilitation facilities, but otherwise it's a rich presentation. Thank you very much.
Lindana, I would be needing some of your, feedback on. Most of us are youth over here, um, and they are dealing with either the peer pressure, which I've observed in different communities, especially living in 7 years in Ethiopia, and also I'm continuing living in Pakistan. I feel both the end. When we start about substance abuse, it starts not just with the problem at the micro level, that is family issues, but it has to do with a lot of acceptability towards the society they are moving along. So the youth which are with us right now, would you like to give them some advice how to keep themselves away from such circle, because intimidation is very easy to be wanted. So if in this way you can just convert something to them, that would be great help.
Okay. Um, I'm sorry. It's Mayim, right?
Yes, Mahi.
Mayim. I actually didn't get your question.
Around the world, especially when we talk about young ones, 16 years
Yes.
to, you can say that, early 20s, they're very much intimidated towards being accepted in every circle, or being accepted in the cool circle, so that they get famous. Acceptability in all
Okay.
ground, the wow factor. This, the
Okay.
wow factor in trends, mostly you can see they are using drugs in their
Yes.
circles. They're using a lot of substance abuse, which they think is normal, but in the long run, it does damage organs. Kids or young youths become suicidal. So that really affects their health. So, would you like to advise the youth who have joined us here right now that how they can keep themselves away from this circle, which is very intimidating because everybody wants to feel wanted?
Okay. Is it possible if I answer you when I finish the whole thing, the whole presentation, then I answer you back? I
Yes,
answer you like
yes, lovely. Why
that
not?
particular
Yes, why
that
not?
particular question.
Yes.
Okay. So in the chat box, someone said they didn't understand the 4 A's. By the 4 A's, I was explaining it when I was talking about community needs. I explained that there is need to increase the access of treatment when it comes to substance abuse. So we are saying that in the community, we already have people who are using substance abuse. So we want to help them. But then the treatment that, like the way we're going to, do the process for them to be sober, it has to be in line with the 4 A's, which is affordability, accessibility, availability, and appropriateness. Whereby we want to make sure that, the treatment process, which there is the rehabilitation center, detoxification, that whole process, it's affordable to everyone. It has to be affordable in that particular community. Everyone has to be able to afford it. It has to be in line with the with the community norms or society. Appropriateness. It has to be available and it has to be accessible to everyone. That's what I meant. Well, that's what I mean by the 4 A's. And also, yes, let us not forget that when it comes to substance abuse, there are certain things that may like someone. I think it's Tishungi who was talking about the issue of unemployment, peer pressure, and the availability of this drug abuse. Yes, there's need to address those things. That's why I was talking about the issue of youth programs, so that youth don't have to be idle at home and be unemployed. But if we have youth empowerment programs, they are occupied, they are able to create jobs for themselves. You get what I mean? So when it comes to peer pressure will always be there. And what I believe is peer pressure will always be there. But we need to help youth. We need to help them to build, to be resilient. And we need to teach them resilient, to be emotional resilient. And we also need to encourage youth that they create, they want to be associated with people who are positive, to create positive peer relations. Because I believe that not everyone is bad and not everyone is going to influence someone to do drugs. There's always that one person who is going to be, motivating you to be a better person for yourself. So there's need to have, support groups where we have different youths where they can actually go support each other, encourage each other to do positively and aim high. So when we do have those support groups for youths, they are going to be there and they will find the need for acceptance from those support groups. They were able to have my relations that they'll be seeking from their peers who, instead of them wanting to join the cool groups where they'll be encouraged to do drugs and substances, they'll have my support group with their fellow peers where they'll be able to notice, okay, this is something that I can do, substance abuse is bad, now they'll have a way of, interacting and find acceptance through the support groups. So I believe that in each and every community, we just have to have, support groups, particularly for youths from different age groups, because we can have them from maybe starting from 9 to 10 or 8 to 10, 11, those age groups that sort of like face the same issues, because we don't have to, put them all like someone who's 9 years old and someone who's 18. They are all facing, like they are all youths, but they're at different stages of life and they face different issues. So we need to have support groups that addresses a certain particular age of people. So I think I've answered Maima at the same time. So, okay, someone just said, can you can I tell you guys what are the actions the government can take for youth? Like I said, for youth, the government might, I think this is something that I'm going to be addressing as we go on through the presentation. So, guys, I'm going to be, I'll answer you as we go through the training. Okay, so now I'm going to be looking at, so now we can move on. I'll address some of your questions later on. So now we're going to be looking at the at developing prevention programs for youth and adults. So we're going to be looking at what programs that we can develop for youth and adults who use substances or who haven't started using substances. So there's need for early interventions for substance abuse or for substance abuse to reduce or to mitigate substance abuse. There's need for my early intervention programs to exist. So these early interventions programs may include, school programs, policies, and so on. So early intervention programs we can do, let's say, in the community, we can have those school programs whereby we can actually go to different society. Okay, we can have school programs whereby we go into schools, we educate children about what is drugs and substance abuse, the dangers, where we can get help if you know someone who uses drugs, or if a child has a parent who uses drugs, how we can help their parents, because like I said, the family dynamic can actually result in people using drugs. So if you are able to help a child's parents who use drugs, the chance of that child of doing drugs substances are close to 0%, because we were able to help the parents to stop substance abuse. Even though use of substance abuse can actually be a genetic problem, but we can actually reduce the chances of that child of using substances on a greater scale. So there's need to do my early intervention programs, whereby we go to school, whereby we introduce in the education curriculums, we introduce, have a topic that talks about substance abuse in the education curriculum. So there's need to go to the government and, ask for them inclusion of this topic in the education system. Say, what, can we please have this topic be taught in schools by the teachers? And, so that children know as they grow up that, doing drugs, it's wrong. And if someone wants to stop taking drugs, this is the process. We educate children from a very young age. There's also, we can actually do, evidence-based prevention programs, whereby we educate people in the community or youths basic life skills, whereby we are focusing on enhancing the personal and social skills, teaching students, adults on how to resist peer pressure, and promoting healthy decision making. Okay, so if we do this, we're able to help them to navigate. If we teach youths and people, if we teach people those basic life skills, we're able to help them to navigate the social systems without depending on drugs or feeling the need for them to take drugs, and so that they cope with their day-to-day life. So there's need for us to, do those trainings, basic life trainings, to do them constantly. We can also have community-based programs whereby we engage the community on different programs that are community-based, so that people will not be idle at home. People will not be focusing on their situations, but their minds will be occupied. When your mind is occupied, you won't feel the need to do substance abuse, because you have things to do. You're not idle, and you're not, stressing. There's also need, we can actually, do programs where we have mentors and mentorees, whereby we have projects or programs for youths where they have mentors. Let's say if someone wants to be a researcher or an author or whatever, they have a mentor in that particular field who's able to help them to navigate the day-to-day issues and stuff. So there's need for that. There's also need for behavioral health prevention plans. What do I say by behavioral health prevention plans? I say that this includes a combination of education, outreach, and support services tailors so that we speak for that tailor the specific needs of the community. Like we are having a combination of the education to have my support services and education outreaches. whereby it has to be in line with the specific needs of the community. Okay, so we're going to also, there's also need to collaborate with different, like this I've said before, that there's need to collaborate with different organizations and stakeholders. We already have communities, I'm sorry, we already have organizations in our communities that are working to address specific issues that exist. So we work with those organizations and say, you know what, we want to work with you because you already have a number of reach for a certain group of people. Okay, or the people in the community, they know you guys, and you are the focal point for us. So we have this program that we want to do. Can we work together? So then you work together with those communities in order to address. You work together with that organization that exists in that community to address the substance abuse. There's also, and then we have different stakeholders. You need to talk to, you need to involve the health professionals, the government, so that there are policies that govern substance abuse and policies that help reduce the use or mitigate the use of substance abuse. Policies against those who sell drugs, the drug peddlers, and and so on. There's need for that also. So I feel like this is something that we can actually do as a community if we put our hands, if we all come together and say, you know what, can the government include this policy, so that there's needs to I believe that there's need to have strict policies against drug peddlers. People who are, supplying drugs to people who, we need to have very strict regulations and laws that are put in place, and have the local authorities to effectively enforce those policies, because we don't want that policies and laws be made and then they are there in the sake of being there, but we want them to be implemented. We want we want to implement it like swiftly. Okay, we just don't want policies to exist in the sake of existing. So it is our duties to ensure that each and everyone in the country has a role to play and does their role, so that we have a better future for everyone, and everyone lives a life that is prosperous, and that has positive outcomes, so that everyone is able to achieve a positive outcome at the end of the day. So do we have any questions so far? Do we have any questions so far? Okay. Okay, we have a question from Laila. What are the solutions to drug abuse, please? I'm leaving this question to the floor. Anyone who's willing, so that we have a bit of an interaction. Anyone who wants to answer Laila, can you please feel free to take the floor and answer her? Do I have anyone from the floor? Do I have anyone from the floor who's willing to answer the question? Okay, so I'll answer Laila. The solutions from okay, I think we have something. Okay. So Rev Chichoni, can you please answer Laila? You can unmute your mic and video so that.
May you kindly repeat the question, sorry?
Okay,
From
so
Laila?
Laila is saying, what are the solutions to drugs and substance abuse, please?
Okay, thank you. I think the main solution in drug and substance abuse starts with parenthood. In your first presentation, you were talking about parenthood, the home setup. Of course, there is peer pressure and other reasons that are contributing to abuse of drug and substance. But I've realized as a practitioner who has been doing drug and substance mitigation measures in Zimbabwe, Victoria Falls, I've realized that most of the triggers, they emanate from the family. So there is need for the family to be conscious of mental wellness of our youths, to make sure that we create safe environments for our youths. Like, for instance, we must fight in terms of sustainability. You have talked of an indicator, which is poverty. You have there is also the indicator of some kind of domestic violence within the home, divorces, high rate of child abuse within the home spheres, especially by step parents, or when the child is orphaned, there's too much of child abuse. So these are main triggers which I feel we need to put emphasis on them. Thank you very much.
Okay. Thank you so much for the contribution, Rev. Chico, he can also add.
Thank you so much for the
Chico.
floor, Lindani. Can you hear me?
Yes, I can.
Okay. I think the solution to drug and substance abuse is complex and requires a multifaceted approach that includes prevention, treatment, support, and policy changes. There isn't a single solution, but rather a combination of strategies that can effectively reduce drug and substance abuse on both individual and community levels. We can start by having prevention programs. These are education and awareness programs in schools, workplaces, and communities. Can implement education programs to raise awareness about the risks of drug and these programs can teach young people and adults about the dangers of drugs, how to resist peer pressure, and the impact of substance use on health, relationships, and future opportunities. We also have got life skills trainings whereby we're teaching people, especially the youth, life skills like decision making, emotional regulation, and effective communication. These can empower them to avoid drug and substance abuse. We also have got community engagements. Communities can also foster protective environments by promoting activities that strengthen social ties, encourage healthy behaviors, and reduce the appeal or availability of substances. We can also have access to treatment. Individuals struggling with substance abuse need access to effective treatment options, including counseling, behavioral therapy, and medical intervention. We also have got personalized treatments plan for every individual that is actually suffering from drug and substance abuse. We also need a support system. Aftercare is also essential to ensure long-term recovery. Peer support groups such as Narcotics Anonymous or Alcoholic Anonymous, community recovery programs, and family counseling can provide ongoing support to help individuals maintain sobriety. Then we also have to have policy and law enforcement. There also should be regulations on drug and substance abuse. There also should be harm reduction policies. There also should be discriminalization and rehabilitation over punishments. I think that's all I've got on that. Thank you so much.
Thank you, Chikomborero.
Okay, thank you so much, Chiko and Rev, for the wonderful contribution. I do agree with them both. You know, when it comes to coming up with a solution to drug and substance abuse, it's a holistic. We need a holistic approach, and it's not a one size fits all. It depends with the community that that we, let's say, that you want to help and that you want to focus on. So I know that in this group, we're all from different countries and we all have, different, we have different names that we give to different, drugs. For example, I'll give you an example. In my country, we have a substance that is called Chikiti. So I want to make it fun. If time does allow us, I would love us to, at least we are the 33 of us, to tell us, just name one drug from their, from where they're coming from. I noticed that some are from Malawi, some are from Pakistan, some of, we're all like from different areas. So I want you to just like by the end of the session, give you the floor and just tell us one drug, how you pronounce it. And, if there are ways to take, like, for example, if I give you an example, here in Zimbabwe, people who use drug have a system of injecting, one person takes the drug, okay, and they inject themselves on, like they take their blood of the person who is high on drugs, and then that blood they'll inject into themselves so that they also get high. That are some of the ways how they are taking these drugs from my country. So I want to also know because this is something that I feel like I'm just remembering that right now, that this is something that I initially had to start from, but I want to give this exercise to the floor. So I want you to tell us about one drug in your community, in your country. We all know there are, some universal drugs like, cocaine, weed and stuff like that. But, people who use substances, they are innovative, creative. They'll come up with new drugs and, or new things just to get high. So as much as they come up with new ways to get themselves high, we as people, or we as researchers, as people who want to help people who are using drugs, we also need to come up with innovative ways to assist them. We also need to come up with innovative procedures, to be able to help them. So I give this task to you, the floor. So as I continue, going on to the last segment of my presentation today, I'm going to be looking at the environmental factors that contribute to substance abuse. So environmental factors and substance abuse, this is a complex situation. Okay. So when we say environmental factors, we are looking at the social, the cultural, the environmental, and physical, and we're looking at the social, cultural, economic, physical, and political aspect of substance abuse. We are looking at all of those systems and how they influence substance abuse and how they influence people to use drugs. For example, like I said, the other thing is you can actually see that when it comes to the economic, we're going to be looking at poverty, unemployment. These are some of the issues that cause people to use drugs. when we have cultural, there are some societies that have normalized the use of drug and substance abuse. It's their norm, it's their culture. Okay, so like I said, we need to be innovative when we want to address these issues. For example, you are going in a community where taking drugs is a norm. When you're going to that particular community, you need to be innovative in a way when it comes to doing, when it comes to addressing those issues. You need to be innovative. You need to be acceptant. You need to come up with a way that we will, at the same time you want to help them. But your treatment of habit, like I said, this is where the 4A's will work, because you want an intervention which is appropriate, which is accessible, which is available and stuff like that. So we also need to, now we're going to look at the strategies that we can actually use to change or to address these environmental factors. So here we can actually do media campaigns, whereby we'll be using different social media platforms, the Facebook, TikTok, and stuff like that. I mean, for example, TikTok is actually popular. It seems like nowadays TikTok, it's the 8th platform, the 8 social media platforms. So there's need to, okay, if resources permit, you can actually use, the influencers, but when you're going to engage with media influencers, you need to be strategic about it. You need to use those media influencers that do not, post any videos, or who do not even take the substances. That's so that the process so that the intervention or the campaigns be effective. Because you cannot be working with an influencer who is who posts videos taking substances. It contradicts each other. It won't work. So you need to be strategic when you work with that, or even on my own. Okay, sometimes resources may not permit. You just have to do a short video on your own, make a TikTok video, helping people, educating people about the drug, all the issues that relate to substance abuse. You can also address the economic factors. There's need to address the economic factors, whereby, like I said previously, we need to have programs for youths. We need to have programs even for people, my empowerment projects and so on. We also need to create a supportive environment, in the community. We need to have a community whereby people are able to feel safe, where people are able to be open to talk about their issue. Like I said, we need to create, if the community doesn't have a community center, we need to have those community centers. And there's a need. So you advocate that the government does help you guys to have a community center where each and everyone can actually come to that community center, and their support group for each and every age, that cater for every age, where people are able to feel open, feel safe, to open themselves and help each other. There's also a need for support group and after school programs for youth, so that when people, after doing their homework and after school, they go to this after school programs and learn some skill, learn something that is productive, so that they will just not be idle still after school, after doing their schoolwork, after doing their chores and stuff like that. But there is an after school program that was able to cater for their needs. So I feel like this is some of the things that we as people, we need to address in order to help people who are using drugs and substance abuse. So for now, I think I have answered. This is the end of my presentation. I was talking about the protective and risk factors of substance abuse, where I was talking about, the solutions that we can actually use to help and assist people who use drugs, and also just in general what substance abuse is, even though it's on my part, I do apologize for that, for having an oversight on that. But then from the chat box, guys, thank you so much. I'm actually learning some really, yes, there's vaping, vaping is actually common now. It's very common. Crystal meth, there's hash. Ken, I don't know how to pronounce your name. Frekaria. Can you please unmute so that you can tell us more about the drug that you stated? Can you please tell us more of the drug that you stated? Or anyone who knows about it? Any questions?
Okay, Betty, can you speak? Is your mic working? If yes, please unmute yourself. If no, please kindly do write in the chat box. Okay, her mic is not working, Miss Lindani. I think it has to do with hash. It's close to a theme, So yeah, we smoke it. Yes, marijuana. Yes.
Oh,
Miss Lindani, we cannot hear you.
Okay, guys, I was saying if you have any questions for us, you can, unmute and feel free to talk.
Samreen, would you like to share something?
Yeah,
Please do.
hello everyone. Yeah, I want to ask one thing. Like I live in Karachi, Pakistan, and we can see so many drug addicts on the roads. But sometimes I see that the educated boys are there and using the drugs. I feel very bad. Sometimes I cry for them because I know so many people who have ruined their life and their family because of these drugs. So I want to know that we have the model in front of us that it is just very bad for our life and our everything. Then why the youth is going to use it, that though we know that it is very harmful for us and we have a live example of that thing? Why we are using them? Yeah.
Okay.
Mhm.
Thank you for the question and contribution. This is what you asked me. Someone once asked me and said, you know what? People we're always talking about, substances are bad. We're always saying, you know what? Don't, we already know what about substance abuse. This is something that we know, but we don't know how to stop. We want help. Then you okay, you have educated us about substances and the causes, the effects, the solutions, but what have you done what have you done, action that you have taken to reduce or to help us? But sometimes you see that sometimes the things that hinder to us to help people who are using drugs are resources. Sometimes we are limited because of the resources. I mean, we may want to help, but the lack of resources, because For example, the whole process needs money, like from the detoxification, like the whole process needs money. So sometimes you end up seeing that organizations might not have the funded or the resources that they need in order to reduce drugs and substance abuse. They may not have the needed resources to help people, but what we can only do is to try to help them with the minimum, like the few resources that we already have. We use them because now you see that people know. Even if you ask my 13-year-old brother, he will tell you the dangers. He will tell you everything, the solutions. But now people want action. But the thing is just that we are just limited to resources. So there's need to use the few resources that we have and try to help them. Like for example, maybe the resources that we have, we're able to have, the support groups. We are able to have the react, like, the programs, the empowerment programs that we can have. So we use those programs. We talk to the people who are using drugs, try to include them into this and programs, into the support groups, because at the end of the day, it is the aim of the resources, or like the specific resources that cater for those people. So that's what I think. But I think we have few people in the comments who want to speak. It's Chico. Feel free, Chico. Chico.
Thank you so much, Lindani. I also wanted to add on to what you were saying. In as much as people are educated out there and there are people taking drugs despite the education, some of these things that contribute to them continuing to take drugs is because of social challenges. Some people have got problems, whether in their marriages, whether in their relationships, whether in their family relationships. There are certain strains that come with all those relationships. This causes someone to take drugs or abuse substances. There are also economical challenges, you see, whereby there is a higher rate of unemployment in a country. There is a higher rate of poverty in a country. There are lack of certain resources to support that graduate to pursue a career. This can also be really stressful to a person, and the person can just, decide to take drugs. Some other people, you'd find that people take drugs because of what we call genetic predisposition. Now, when we're talking about genetic predisposition, we're talking about genes in a family that are vulnerable to substance and drug and substance abuse. So this person is not only taking drugs just because they want to, have a nice time, but some of these people actually have got genetics that are vulnerable to drug and substance abuse. So some of these things can be some of the reasons why people continue taking drugs can be due to genetic predisposition, can be due to the employment rate in a country, can be due to poverty in a country, can be due to lack of resources to support graduates in a country. There are a lot of factors that contribute. Also, there's also the thing that Mem Lindani talked about that comes about with issues of resources. Lack of resources has a lot of drug and substance abuse abusers in the street, because many people really would want to help, but they don't, or we don't have the resources to help. So now we're only forced to look at the people, try and provide the little we have, but it doesn't really go a long way. So I also think that there's need for maybe governments, there's need for policymakers to also put in place policies and funds that actually go towards fighting drug and substance abuse in a country. I hope that managed to also answer you, ma'am.
Yeah, but in our country, especially Karachi, the police is involved in distributing all these things. So it's not possible for us to make the police stop it, because they are providing it to the people.
I would like to add here something. It's true. It's
Yeah.
entirely,
Yeah.
when you talk about Pakistan, it's entirely rooted not just in our society, point of view, but also in politics. The system supports
Yes.
this idea because they make money out of it. There's a whole mafia
Yes.
behind it. And also, I had a privilege to work in academia. I'm going to give you example of Pakistan. I'm still involved with academia in Pakistan as a counselor. And when I go to university, observe students, and see what is the problem, I have some. I would categorize two sets of counseling I do. One, who are wealthy, they're going to private institutions, paying like thousands of dollars per year. The other category is that they are in public university and they are on scholarships or maybe on just like funded programs by government. So it's kind of like they're not economically strong. But when you look into both prospect of students, I'm talking about individuals, the problem is vulnerability. They don't have self-esteem, they don't have self-actualization, they don't have confidence, in short, because they don't have communication with their family. They are lost and they're finding way to adjust themselves, and they are in that point of life that they would do anything to be accepted. Anything to be accepted. They want to take that particular shortcut to feel accepted, and they feel like eventually if I'm accepted, I'm gonna make money, I'll be okay. All right, so this is the phenomena that I am observing in youth. Vape is one of the very example. To look cool, people have shifted to cigarette, now moving towards vaping. All right, the same way during examination, many of the students take ice to support themselves. So they are taking dependencies because they don't have self-esteem. They don't have self-actualization. They don't have anyone to talk to. So they are getting support through these medium to move ahead. And in Karachi especially, getting these substances is so easy. It's so easy.
Yes.
Um,
Correct.
this is a big question mark for all of us because in academia, we have a big security system in which we check the bags before students come in the campus and XYZ. But still, when they go outside of the campus, they have agents out there through which they can get the substance. And you cannot track them down. Eventually, if you do, they're out in few hours because they have the support, like you said. The system is involved in this.
Yes.
It's a huge
Correct.
mafia. Yeah. So what we can do, what I have always done so far in last decade is that to involve parents in conversation. Okay, because we have to change our parenting style. We have to change our ways because we have to understand what's happening with our children so that they don't involve into this cycle. And every society has our own dynamics, and we are talking about Pakistan's right now, and especially Karachi.
Yes.
Thank you,
Yes.
Samreen, for this question.
Thank you.
Okay. Farida wants to speak. You can actually unmute Farida. Unmute, unmute, and pause your camera so that you can actually speak.
Hello. Hello, good day, everyone.
Good
I
day.
hope it's fine if I speak without on like the video because I am unable to switch on my camera right now.
Please carry on.
Okay. So I have a comment and a question. Earlier, Lindani, when you were speaking, you mentioned causes that make people fall into these drug uses. And you mentioned the cultural, the economical, the emotional, physical, and political causes. But I had wanted to hear your view on the political causes of the reasons or causes, I'm not sure the term you used, for the abuse of substances. How exactly is politics involved? I do have a theory, but I wanted to hear your view on it before going on with my theory.
I would like to give you a hint, Farida, because we cannot just take names exactly. But let me explain you the cycle, Farida. It's more like you are in a system where everybody has a business. And when you are at that position, where can you deal and collaborate and counsel the business people, they have other things to do to make money. All right, and business could be anything. Some are legal, some are illegal. So the easiest way to make money is the other way around. All right. For example, I am the bad person. I have a textile industry. I have some other trading agencies. But on the sideways, I'm dealing with such substances in order to make more money. Okay? So when you get into that system, it has one reward. You can change your status from millionaire to billionaire within 1 year. And then you take retirement. So if that's your plan, and that most of the people actually do, all right, because they want to have a fulfilled life in terms of money. Okay, so they involve in such business dealing under the file, and you cannot beat that cycle because people are willing to do so. You cannot beat that cycle because if they want to be in that power position, they want to have money. If they want to have that power position, they want to have conversation with these people, befriend with these people to remain in the system of power, in control. And it itself is an addiction when you get into power game. And that's the dilemma. And anybody who is in power for a long term, it has so many stories behind it. So, nothing is transparent, but only research, education, connecting the dot makes sense out of it. So, it's not transparent at all. You cannot just say it. It takes a lot of investigation. But eventually, when you get into the system to fight them, eventually. So this is the basic hint I can give you, Farida.
Thank you very much for the input. Actually, when I heard the mention of political involvement in the whole drug abuse system, because unfortunately for us, we cannot really do much as individuals and societies without heavy impact or heavy support from the government. We do need their help in, like, as was said earlier, we need their help in making policies and controlling the flow of the drugs in the society. So unfortunately for us, we can't really do much without them imposing those laws. So I was thinking that because of the effects that drugs have on the human mind, if continuous exposure to drugs unfortunately diminishes your self-worth, your self-value, how you view yourself. So I personally thought it was some of the reason could be easy manipulation, because people because drugs are more popular in the lower class of of the society. So it makes it easier to manipulate, in quotes. It makes it easier to manipulate the public because they're mostly on low value. They don't really give that much value to themselves. So that makes it easier for the government to control them. It's just a theory of my own, by the way. There's no backing, of course, of the statement I'm making. So I think it could also be some of the political effect, if I might say, for the causes for drug abuse, if I'm making sense, of course.
I think the law always goes around the people who are not economically strong, but it's not just the one who are not economically strong who are using a lot of substance abuse drugs. It's the higher class as well, which is in curtains, in bail. So once you jump into Farida, the stories behind how these things really get penetrates, okay, so you will understand it's just about putting these substances to the segment who can easily get into it, okay, and especially the middle class family who are striving to reach the top tier. I feel like they are the most vulnerable ones, because in private universities, their parents did their best to provide them the best education system with their wealth they have. But the involvement they have, Farida, with a group of individuals to get that top tier position are the ones who promote substance abuse in the form of either drinks, powder, cigarettes, smoke, you name it. So you need to understand the cycle. The one who are not economically strong are being blamed the most. Yes, we are affected, but who are promoting it is the top tier. Okay? We had Chikomborero raising hand, please. Chikomborero.
Thank you so much, ma'am. I wanted to add something on what ma'am had said earlier. It's not only the lower classes that are actually suffering this issue of drug and substance abuse, but it's the higher classes that started with this issue, and it just, trickled down to the lower classes. Because I'm going to give an example in Zimbabwe, whereby most of these that hence it wasn't going to sit so well having a higher class or people with a status of a higher class in the society being the only ones abusing drugs. At the same time, they're the only ones in power. It wasn't going to balance well. Therefore, I feel like there was a need for introduction of drugs that are much more cheaper. You'd find that we've got what we call, there's a pill called Dombo, which is vernacular. I actually forgot for the English name. Dombo is actually $1 for 20 pills. Now, these pills will give you 12 hours of you just having a high dopamine release. Those feel-good chemicals in our body. So this is 12 hours per pill for someone, and it's only going for $1, $1 US. Now, each and every Tom and Harry in Zimbabwe is able to get their hands on $1. Thus, it's easier for them to access. So I also believe that somehow in our society, drugs were made so easily accessible even for the lower class that they made drugs that are for the lower class. I'll also give you an example of Nyaope. This is a drug that is being found now in Zimbabwe, coming in from our southern fellows. It's called Nyaope, is a mixture of red poison, chlorine, ARV drugs, antiretroviral drugs, and milk powder. Now, all of these are easy to find substances that are mixed to make one drug. And they're also easily accessible to the normal him and her in Zimbabwe. So somehow, I do believe that politically, there is a factor of politics in this whole entire drug and substance abuse situation. Thank you so much, ma'am.
Thank you so much, Chikomborero.
Thank you very much.
Lindani, would you like to add something?
No, I have nothing more to add. I was just reading through the conversations about the drugs. Some interesting names are really coming up. I think this is something that we can actually continue in the WhatsApp group, where people can actually, continue discussing and sharing information about today's topic. I know that as you try to process everything that we just discussed, you come up with, you think about something new that, another question may just pop up. So I think we will use the WhatsApp group to finish the conversation. On my end, I have nothing more to add, but I just want to thank you guys for this opportunity that you have given me to talk about drugs and substance abuse, to share my knowledge, and I was able to learn a few things from you guys, and I thank you for that. And I look forward
so much.
to doing this more often with you guys. So yeah, thank you.
Thank you so
Thank
much.
you so much.
Thank you.